Hi everyone, welcome back. Today I want to talk about something we take seriously in the operating theater: infection prevention. A lot of people only see the surgery itself, but there's a whole system behind the scenes designed to protect the patient. This is something we do every single day, and this is what keeps our work safe and clean. So let us break it down properly. What is infection prevention? Okay, this will be our point number one. Infection prevention is basically everything we do to reduce the risk of surgical site infection, and it isn't just a one step, it's a combination of good habits, good environment, and proper technique. From how we wash our hands, to how we open our sterile trays, to how the room is cleaned. Every detail matters because surgery doesn't give a second chance. Okay? Now, let me talk about hand hygiene. What it entails to hand hygiene. Let me start with this most important one. Hand hygiene is everything before anything else. We wash our hands, whether it's a normal hand washing or full surgical scrub. This step removes the bacteria we carry around from touching surfaces, phones, or even our own skin. In theater, you never just quickly rinse. We scrub for the right duration, paying attention to the nails between the fingers and up to the elbows. And once you scrub, that it is. A lot of contamination happens after scrubbing, and that's where discipline comes in. We don't take chances when it comes to hand hygiene, okay? And we don't assume. In case you suspect you've contaminated yourself, you just redo it, okay? Now let us me talk about gowning, gloving, and masking. After hand hygiene, we go to PPEs. This include gowning, gloving, mask, caps, eye protection, everything that reduces the chances of transferring bacteria to the patient. After donning and doffing, you your mask stays on. You don't adjust it with sterile gloves. Your cap covers your hair properly. Shoe covers the shoe. All these layers create a barrier. Once you're gowned and gloved, your hands are sterile. That means you only touch sterile surfaces. If you accidentally touch something non-sterile, you don't hide it. You reglove or you reground. Reground. Now, sterile field management. How we manage our sterile fields. This is the area we protect the most. It includes the sterile trolley, the drapes, the patient, and anything open for the procedure. We don't lean over the sterile field. We don't pass between a sterile team member and a sterile table. We watch where our elbows are. Data is controlled, not chaotic. And if something gets contaminated, we fix it immediately. You don't assume it's okay, it's not okay. The sterile field is a sacred place. We don't take chances at all, at all. Now let us talk about instrument sterility and handling. Our instruments come from the CSSD, the Essential Sterilization and Storage Department, sterile and ready. Before anything else starts, we check the packaging, the indicators, the integrity of the wraps, etc. When the tray is opened, we handle the instrument carefully, sterile to sterile, non-sterile to non-sterile. Once an instrument is used and becomes contaminated, it doesn't go back to the sterile tray. It goes to the dirty area for reprocessing. We also avoid touching instruments to surfaces that are not sterile. Even simple things like the edge of a trolley. Those small moments can break sterility. Okay, we don't mix clean and dirty instruments. Now, let me talk about patient preparation. Infection prevention also includes preparing the patients. This means using the right skin prep solution, cleaning the area properly, and allowing adequate dry time. If hair needs to be removed, we use clippers, not razors. Razors can cause microabrasions that increase the risk of infection. Then comes draping, creating a clean, sterile zone around the surgical site. That is the use of a drape. It's a key step because once draped, the only sterile part is allowed for the procedure. We talk about the environmental controls, the measures that we take around the environment in the theater. The theater environment itself plays a huge role. The room must be cleaned before and after cases. Floors, surfaces, and equipment must be disinfected. The trolleys, airflow and ventilation help reduce airborne particles. And then there's a traffic control. Data is not a pass through. Every unnecessary door opening affects airflow and brings in contamination. So we limit movement and we keep the space quiet, controlled, and focused. The other thing that we do to prevent infection in theater is teamwork and communication. Infection prevention is not a one person job, everyone in the theater contributes. Nurses, surgeons, techs, anesthesia, cleaners, CSSD. You see a break in sterility, you speak up. That culture of accountability is what keeps patients safe. No one should ever feel embarrassed to call out a contamination. It is better to fix it than risk an infection. Now let us talk about common mistakes to avoid while you're in the theater. Okay, a few common mistakes we see and we try to avoid them as much as we can. Touching your mask while your gloves you've gloved, leaning over the sterile trolley, putting phones in theater, rushing through the draping, bringing too many unnecessary people in the theater, poor communication. These are some of the things that can cause havoc or can be hazardous in the theater. Okay, and can lead to huge complications. Now, so that's the foundation of our infection prevention in the operating theater. It's not a dramatic thing, it's not loud, it's consistent, discipline, and every small action protects our patient. That's our major aim. This is why theater seems to take these steps so seriously. They are not habits, they are life saving practices. If you enjoyed this or you want more of theater related content, feel free to stick around to the next video. Please don't forget to like, share, and subscribe. Until next time, bye.